Hi, everybody. Today we're going to talk about nitric oxide in immune health. So nitric oxide, the miracle molecule, the molecule that touches every single physiological function. Nitric oxide regulates all cardiovascular function and homeostasis, governs circulation and microcirculation. Red blood cells actually require adequate nitric oxide to deliver oxygen to cells. You could be hyperoxygenated, but without adequate nitric oxide, you are not being able to deliver that oxygen to the cells. Nitric oxide supports neurotransmitter function, regulates gastrointestinal function, including gastroparesis, mucus health, and the health of the microbiome everywhere. It helps activate GLUT4 receptor in order to translocate and bring glucose into the cell. Nitric oxide controls the efficiency of the mitochondria in the generation of energy and the generation of hormones. This is where cholesterol gets metabolized into pregnenolone. Nitric oxide is essential for sexual function in both men and women. It's essential for stem cell mobilization and differentiation. Nitric oxide is required for the stem cell to be able to go where it needs to go, do what it needs to do, and stem cells are essential for any healing to take place. Nitric oxide regulates the immune system function, regulates the inflammatory response, and scavenges free radicals. It modifies platelet activation and aggregation. This is the clotting. This is what this factor we're seeing so much in the pandemic and in recovery, and supports telomerase activity. And this has everything to do with longevity. So how do we make nitric oxide? We make it through two different pathways. One pathway, the arginine NOS, nitric oxide synthase pathway, oxidizes arginine into nitric oxide and citrulline, and further oxidizes it to nitrate and nitrite. The nitrate pathway, we consume the nitrates, they get absorbed, travel around, get concentrated in the salivary glands. The salivary glands release the nitrate, and we've got good bacteria on the dorsal aspect of our tongue that will reduce that nitrate to nitrite. The nitrite gets swallowed, and in the acidic environment of the stomach, some of that nitrite is reduced further to nitric oxide, but most of the nitrite is absorbed and acts like a nitric oxide donor. It's a storage form of nitric oxide. And we have other tissues and enzymes in the tissues that can reduce that nitrite further to nitric oxide. For example, the myoglobin in the muscles can reduce nitrite to nitric oxide on an as-needed basis. Hypoxia stimulates this pathway. Acidity stimulates this pathway. So as we age, our ability to make nitric oxide diminishes. As women, we can hold on to our ability to make nitric oxide a little better than men until we reach the menopause years. Once we hit menopause, our ability to make nitric oxide kind of evens out with the men, and that's why cardiovascular disease is so rampant in post-menopause. So by the time we're 40, the ability to make nitric oxide through the NOS pathway decreases to about 50%. By the time we're 60, it's decreased to about 15%. So this is why it is essential to support that nitrate to nitrite to nitric oxide pathway to optimize the nitric oxide for healthy longevity. So the current factors affecting nitric oxide formation: aging, we talked about that. The diet, the standard American diet, devoid of essential cofactors and nutrients, and devoid of nitrate-rich veggies. The lack of exercise, medications, antidepressants, antibiotics, NSAIDs, birth control pills, PPIs, proton pump inhibitors, inhibit the production of nitric oxide through both pathways. Pollution, or anything that increases oxidative stress. EMF increases oxidative stress. So oxidative stress uncouples the NOS enzyme. When the NOS enzyme is uncoupled, it becomes a superoxide generator, not a nitric oxide generator. And so this gets into a bad vicious cycle. We've got uncoupled NOS increasing the superoxide, increasing oxidative stress, which increases the uncoupling of NOS. Genetics, and not just your NOS SNPs, your NOS SNPs. So anything that increases oxidative stress, your SOD, your catalase, your HFE SNPs, anything that interferes with the production of BH4, your QDPR, your DHFR. If you have any MTHFR SNPs, you are by definition nitric oxide deficient. And that's about 40% of us. And the big one, stress. Stress uncouples that NOS enzyme, increasing oxidative stress. And look at all the stress that we've been under this last over a year now. So nitric oxide is essential in our immune response, and it's our defense against virus, bacteria, fungi, and other pathogens. It regulates macrophages, T lymphs, antigen-presenting cells, mast cells, neutrophils, and natural killer cells. It is an immunoregulator. So vulnerable populations in the current pandemic have lower levels of endogenous nitric oxide. Aging and obesity, these two factors are the biggest comorbidity to coming down with the virus, to not being able to recover, but also diabetes, metabolic syndrome, COPD, autoimmune disorders, hemoglobinopathies. All of these have lower levels of endogenous nitric oxide. So we've got iNOS, the inducible nitric oxide synthase, the NOS2, this is part of our immune response. And we've got eNOS, endothelial NOS, NOS3. This governs circulation and microcirculation. And I like this quote by Dr. Nathan Bryan, the premier nitric oxide researcher. He said, well-vascularized tissues are more resistant to infections and capable of localizing containing offending agents. By contrast, poorly vascularized tissues are relatively inefficient in responding to inflammatory stimuli. If you have good circulation and blood flow to every tissue in the body, then this allows your immune system to mobilize a strong defense against any invading pathogen. So this is important. We need both the iNOS and the eNOS to function. So what happens to the vascular system when it's depleted of NO? You have inflammation. You have that increased platelet aggregation, the clotting, the thrombus. You're not delivering your oxygen correctly. You're not being able to remove the toxic byproducts because the blood flow is stagnant. So in C19 has been caused an endothelial disease, an endotheliitis, inflammation of the endothelium. So you have vascular damage, you have direct viral infection in the endothelial cells. You have enhanced clotting and sluggish blood flow, resulting in hypoxia. And the NOS enzyme requires that oxygen or else it cannot function. And the lung receives the most blood flow of any organ. So if the vascular system is impaired, you've got damage, increased hypoxia, things aren't oxygenating. And the lymph, this is part that a lot of people don't remember. It's an essential part of the immune system. And the lymphatic vessels are lined with endothelial cells chock full of eNOS, making the nitric oxide, and this is responsible for the contractions, for the lymph flow. But during inflammation and oxidative stress, that eNOS is not able to produce that nitric oxide, and those contractions are not having, so you've got stagnant lymph and stagnant blood. So iron dysregulation negatively affects the outcome. Ferritin levels are correlated with disease severity. So the SARS-CoV-2, once it gets inside through the ACE, attacks the hemoglobin. It oxidizes the ferrous iron to the ferric iron. This oxidized ferric iron becomes cell-free heme. This cell-free heme cannot carry oxygen. So hypoxia pathways are stimulated, which activate more virus, stimulate more pro-inflammatory cytokines, and this ferric heme damages endothelial cells, including in the lung. But here we've got nitric oxide trying to help us. Nitric oxide is scavenging this cell-free heme. But then this takes that nitric oxide out of being bioavailable. So it can't do all these good things that we need it to do. So this rapid loss of nitric oxide leads to hypertension, coagulation, and systemic inflammation. This is what we see during and after. So this loss of endogenous nitric oxide reduces our ability to suppress viral replication. And here is all the ingredients for a failure of the immune response. So stress, remember I said stress, downregulates our ability to make nitric oxide. The adrenals require adequate nitric oxide to function effectively, and the glucocorticoid production increases in the absence of nitric oxide. So nitric oxide deficiency increases that stress response, increasing the cortisol. And this cortisol, this hormone that naturally increases with age, inhibits both iNOS, the inducible NOS. So that's why when we're stressed, we get sick easier. Our immune response is impaired. And the eNOS, the endothelial NOS. And that's why when we're stressed, all these cardiovascular complications, the hypertension, the strokes, the MIs. Cortisol decreases the synthesis of BH4. BH4 is the cofactor that keeps the NOS coupled. So when you're decreasing the synthesis of BH4, you increase the NOS uncoupling, which increases oxidative stress, puts you in this bad, vicious cycle. Cortisol decreases the membrane transport of L-arginine. So all of these decrease the production of and or make nitric oxide not bioavailable. So we're going to talk about the gastrointestinal defense. This is part of the gut-brain immune axis. 70 to 80% of our immune response is located in our intestinal tract. So nitric oxide will increase mucus secretion. It reduces degranulation and mediator release of the mast cells, decreasing the histamine release. Nitric oxide reduces the cytokine release from the macrophages. It increases formation of new blood vessels, vasodilates the vasculature, accelerates wound healing, reduces adherence and secretion of the neutrophils, and decreases oxidative stress. So our mucus is our first line of defense against pathogens. It's that protective layer to balance good and harmful bacteria. It's exposed to many damaging substances, alcohol, nicotine, drugs like NSAIDs, H. pylori, hyperosmolar solutions, bile salts, the ischemia reperfusion events, and stress. So nitric oxide is the essential mediator for the cholinergic stimulated mucus release. It increases mucosal blood flow to dilute the toxic substances and neutralize them for removal before accumulation to damaging concentrations. So supporting that nitrate to nitrite to nitric oxide pathway will increase mucosal blood flow and vasodilation. It increases mucus production and thickness, modulates the mucosal immune response, prevents active peptic ulceration, and repairs that NSAID damage to the intestinal tract. So there's even a few drug companies that have patents out on NSAIDs connected to a nitric oxide donor. So they've known about this damage that the NSAID does to the mucus lining for decades. So nitrates rebalance the ratio of Th cells in the peripheral blood, decreases the pro-inflammatory Th1 and Th17, decreases interleukin 17 in the colon, decreasing inflammation. So nitrite has been shown that it may even prevent colitis and colorectal cancer. Nitrates increase the Treg cells to maintain homeostasis and self-tolerance. This is the autoimmune connection. Nitrates decrease myeloperoxidase activity in the gastric mucosa, decreasing reactive oxygen species. Mast cells become activated in the absence of nitric oxide, and this increased superoxide production activates mast cells. So this is another one of those vicious cycles. The nitrates and nitric oxide regulate the activity of the mast cell, inhibits the mast cell inflammation, suppresses the degranulation, suppresses mediator release, including histamine and the cytokines, the NLRP3, interleukin 1B, interleukin 6, interleukin 17, interleukin 18, inhibits leukocyte endothelial cell attachment, and inhibits generation of reactive oxygen species by mast cells. So these mast cells are important effectors of the gut-brain immune axis, translating stress signals into the release of neurotransmitters and pro-inflammatory cytokines, leading to cognitive. So the tight junction proteins, we have them in our intestinal tract, we have them in our blood-brain barrier, our eyes, our kidney, the bile duct, the skin. These are important in epithelial transport as well as barrier integrity. These loss of tight junction proteins, the breakdown of the barrier, and causes leaky gut, leaky blood-brain barrier. So things get through that shouldn't get through. So dysbiosis, you have decreased expression of the tight junction proteins occludin and claudin 5. Nitrate consumption supports rebound levels of occludin and claudin 5. And those tight junction proteins are seen in every single one of those other, like the blood-brain barrier, the eyes, the kidney, the bile duct, the skin. BDNF regulates the intestinal barrier integrity. It affects the tight junction proteins. So decreased BDNF increases IBS. BDNF also has a role in depression, anxiety, learning, and memory, but nitric oxide is an essential mediator of BDNF. So chronic stress causes inflammation and damage to all cells, including the GI tract. So stress will alter the motility, changes the secretion, increases intestinal permeability, decreases the capacity of the GI tract to repair, decreases mucosal blood flow, has negative effects on the intestinal microbiome, and stress also inhibits the production of nitric oxide through that NOS enzyme by downregulating iNOS and eNOS. So nitrates address every single one of these effects of stress. And also supporting that nitrate to nitrite to nitric oxide pathway can enhance that gut-brain immune axis through improved sleep, less anxiety, decreased depression. So antibiotics are really tricky. So they decrease the microbial richness and diversity. They're linked to intestinal disorders, leaky gut, mental health issues, that gut-brain immune axis, anxiety, depression, brain fog, fatigue. So nitrates taken during antibiotic therapy will downregulate the gastric mucosal inflammatory pathways, prevents inflammation and the resulting increased epithelial permeability. Nitrates increase the biomass of the microbiome, acts as a substrate for existing microbial communities, and prevents dysbiosis. So the oral microbiome modulates the gut microbiome. We're seeding the intestinal tract every time we swallow, we eat, or drink. 45% of the bacteria in the oral cavity and the large intestine overlap. The health of our oral microbiome affects our systemic health. So nitrates prevent or reduce bacterial dysbiosis and stimulates eubiosis. Continued nitrate supplementation will actually increase nitrate-reducing bacteria on the tongue. It will decrease levels of bacteria that are associated with poor oral and systemic health. Nitrates restore the local immune and inflammatory responses and protects the gut microbiome under inflammatory conditions. So lately there's been some studies using nitrite as an alternative to standard antibiotic therapies because nitrate can disrupt the protective biofilm. In UTIs, nitrite and vitamin C were more effective than a broad-spectrum antibiotic for a chronic UTI, because UTIs are notorious for having bacteria in their protective biofilms. So supporting the health of the gut supports the health of that gut-brain immune axis. Nitrates inhibit the inflammatory process, downregulate oxidative stress, scavenge free radicals, scavenging that cell-free heme, decrease inflammation, Nitrates downregulate iNOS. Sometimes this iNOS gets into this stuck on position, and nitrates will help regulate that. And when iNOS gets upregulated, eNOS gets downregulated. It's a powerful modulator of the microbiome. Nitrates prevent dysbiosis, prevents leaky gut, promotes that healthy gut-brain immune axis, modulates immune and oncological pathways, and maintains homeostasis. So the brain part of the gut-brain immune axis needs to have adequate blood flow. Blood flow to the brain carrying oxygen, nutrients, and glucose, and removal of waste can affect how that brain performs. Cognition, fatigue, sense of well-being are disrupted. And that's what we're seeing in some of these long haulers. So nitric oxide has a role in synaptic plasticity, mediates that neuroprotective action of BDNF, the learning and memory, the anxiety, the depression. These inflammatory cytokines alter behavior and cognition, the brain on fire. So nitric oxide will decrease neuronal inflammation and oxidative stress. And that inflammation and oxidative stress, these are primary drivers of most chronic diseases and the propensity to actually come down with the virus or not recover. So optimizing nitric oxide during inflammatory states, like we have with the virus, with recovery, will block that cytokine storm. It downregulates the inflammatory cytokines, your NLRP3, interleukin 1B, interleukin 6, interleukin 17, interleukin 18. Decreases mast cell degranulation and histamine release. Downregulates the ACE, and this is the way the virus gets in. Restores functional capillary oxygen delivery and the removal of waste. Tissues need the oxygen delivery. They need to be able to get rid of the waste. Prevents a hypoxia, reperfusion injuries. Optimizing the nitric oxide protects the oxygen-sensitive organs like the kidneys and the lungs, and it limits lipid peroxidation and concomitant cell damage. So supporting that nitrate to nitrite to nitric oxide pathway with oral nitrates increases nitric oxide directly and helps recouple NOS. This decreases oxidative stress. It downregulates the NADPH oxidase, a NOx enzyme, whose only job is to make superoxide. It helps recouple the electron transport chain, decreasing oxidative stress in the mitochondria. It's protective and reestablishes the endothelium function, may protect against that endotheliitis, inhibits thrombosis, those blood clots. It addresses the pulmonary and arterial hypertension, decreases viral activity and replication, and encourages antimicrobial activity. So ascorbic acid works synergistically with nitric oxide. So vitamin C will reverse or inhibit this cell-free heme damage in the lung. It maintains a macrophage balance. Ascorbic acid is the only molecule that can reduce BH3 back to BH4. Without enough vitamin C, BH3 oxidizes to BH2. BH2 uncouples NOS, which then leads to increased oxidative stress. So vitamin C also supports the production of nitric oxide through that nitrate to nitrite to nitric oxide pathway. Melatonin is an essential partner with the nitrates and the ascorbic acid. So melatonin will help normalize eNOS. Melatonin will actually help increase the endogenous production of melatonin itself in the mitochondria. So only about 5% of our melatonin is produced in the pineal gland. So 95% of our melatonin is actually produced in the mitochondria. And by supplementing with melatonin, you actually support the melatonin production in the mitochondria. Melatonin will decrease the cytokine storm by inhibiting the NLRP3 inflammasome, which then goes on to inhibit the IL-6, the interleukin 1B, the interleukin 18, protects against hypercoagulability and thrombosis, decreases hypertension, is cardioprotective, and prevents or attenuates a hypoxia and the myocardial injury during C19. So these three nutrients all work together for prevention and recovery. So nitric oxide production naturally decreases with age, reducing to about 50% by the time we're 40 and as little as 15% by the time we're 60. Supporting that nitrate to nitrite to nitric oxide pathway not only increases nitric oxide directly, but it helps recouple that NOS enzyme to increase nitric oxide and decrease oxidative stress. And it's pretty easy to be able to check somebody's ability to make nitric oxide through that nitrate to nitrite to nitric oxide pathway with just a simple saliva test. So supporting that nitrate to nitrite to nitric oxide pathway helps with prevention, recovery, and healthy longevity. Thanks, guys.